I'm Rosie Gilbert. I'm a trainee ophthalmologist at Moorfields Eye Hospital. I'm very excited to be here today for my Eating for Eye Health project, where I've got patients with age-related macular degeneration who've come together to cook a healthy, nutritious meal which we're all going to share together here at the Central Street Cookery School. It's about practical tips about what you can do day to day and recipes and things like that. And I think this is as much about me learning from you as it is about you learning from us.
Particularly in the early stages, they may just have been noticing that they haven't seen as well, for example, for things like reading or their daily activities. And I think many of them might think it's a cataract or something that they can have surgery to remove. So I think the fact that we're telling them that it's an eye condition which is progressive and which there's no treatment for, that can be deeply distressing for people.
The main thing, once you hear the diagnosis and the shock of that you do have a long-term condition that's going to progress and get worse, you do need some help, some backup really, not just to be left with that kind of diagnosis.
Basically, the idea was to base your diet around these sort of antioxidants, which are also helpfully very colourful foods. So that was the message today: eat colourful. We split people into small groups. We had 2 people at each station, and we set them to work doing a different part of the menu.
I haven't really been motivated to cook very much, and I thought this would give me new impetus and again to make sure that I'm doing the right things and eating the right things.
I'm making a baked sweet potato. It's a very simple cooking, so if I have nice sweet potatoes, I will do it.
I find it very difficult to see without glasses, and these are not very good anyway. So then I have to have magnifying glasses everywhere in my house. Trying to cook with steam and everything, it gets very complicated.
When you're cooking together, it's more fun, it's sociable, people are having a laugh and getting to know other people, and also it's breaking down isolation and things like that. Some people might be at home and be on their own, but today they're coming together in a social situation, so that's really good.
While the food was cooking, we had a little break where we talked about some of the ingredients we were using, and we also did a food tasting where people had an opportunity to try some sort of healthy sort of superfoods that they might not have tried before, or try them in a different context.
I just learned today that one Brazil nut, a good size, large Brazil nut, has enough psyllium for the body for a day.
There is no cure for this form of disease, so diet is the one way you can actually try to improve your eyesight, so that's why the nutrition is particularly important. We're going to sit around this room in here and have our meal all together.
So we prepare these signs, so if they enjoy the dish, say, yummy. And if they actually don't really like it, we have this one for yuck.
Fortunately, everybody chose the yum sign at the end of every course, so that's good, that's positive feedback, and that's what we want.